Hi, Evan. Thank you for being here.
Oh, absolutely. Thanks for having me.
Yeah, so I'm here with Dr. Evan Goldstein, who's teaching a class all about anal, where we'll talk about anal health and anal sex and learn about clinical insights for modern patient care. So, Dr. Goldstein, tell me a little bit about what we're going to learn in this class.
Yeah, all things anal, right? I mean, I think the key for many people is a little bit more clinical of like if someone comes to my office and they've never engaged in anal sex, like how do we just take it from there? And it really dives into a lot first of understanding and asking questions of what type of sex do people want to engage in? Under looking at the myths, the taboos, all so kind of pressures and societal stigmas that are associated with it, to then really understand where they are and where they need to go. Then it's really understanding more the anatomical side. So a lot of what we talk about is first for people to understand what is the anatomy locally, skin, muscle, neurological control, psychological control. So all of those things that goes into kind of everyday, every ass anatomy, right? And then it's more of, which type of anal anatomy do you have? And through our work at Bespoke Surgical, we've done a lot of work to understand each individual pelvis. And there's basically three types of pelvises in the world. And what are they? Why is it important? What do they, what is the differentiating factors? And where does all of that architecture play differently? Because we see a lot from born male to born female to trans patients to lots of differences and small nuances in pelvic floor, muscle, skin, architecture, and all of those things. Then we're going to go into a little bit more of like, well, okay, the how to. How do I get into things from anal dilators and the brand that I started called Future Method and kind of products that support the way we engage? Why do we use glass dilators versus others? What about what's the difference between a glass dilator and kind of a silicone cone and why we're doing those and kind of my protocol to allow people to get into the good sex that they want to. Through doing that, you then start to kind of see, well, what happens if you can't progress accordingly? What are some of the roadblocks and the obstacles? And how do we understand what those are from ourselves and also as a clinician to figure out where people are? And then I categorize people into kind of buckets. Can people do things on their own? Do they need physical therapy, kind of sex coaching, mental health, and physical work? Um, and adding anal Botox and kind of all of those components. And we'll talk a lot about that. Or do I first need to do surgery where there's something wrong, whether it's muscle, whether it's hemorrhoids, skin tags, something that is creating limitation and not allowing people to engage the way that they want to. Once we talk about that protocol of toys, then it's like, okay, how do we get to the real deal? What positions work well? Why start with X, Y, and Z? How do you get further into things, whether it's just more advanced positions or fisting or larger toys or double penetration? Lots of different things that people want to know about. And then obviously it's the lead into that. So do I need to douche and clean out? What about my food intake and fiber and diet and kind of really understanding the nuances that everyone puts so much pressure on themselves to be clean and what does that really mean to then translating that into the sex side. And then if we have time, hopefully we'll have some time, but more of, well, what if things go wrong? What if I need to do, what if I'm bleeding? What if I'm having pain? What are the things that I need to do to really help people get into a good space so that then, okay, if things happen, where do they go? Do they have practitioners that understand what we are talking about? And how do we set the stage for people's success? So it's basically following a lot of what I wrote in my book. I wrote a book called But Seriously, and it's kind of like, literally targeted through all of those things to allow people to truly understand. I say anal sex is And the S itself is overtly simple, but clearly there's nuances that once you're aware of it, it allows you to really get into a truly good space.
I'm so excited. That's such important information. And as you mentioned at the beginning, there's still so much stigma and taboo around it. And I think, comes from a lot of things, but fear and also not being educated, So, it's amazing how important it is for clinicians to be educated to then educate their clients when they come in with all this misinformation, which is usually what happens. It's not just, not having information, it's misinformation typically is what I find. So, what do you think the biggest stigma that you see around this is?
Well, I think especially in the hetero space, which is if I'm into anal play, I must be gay,
Yeah.
right? Or on
Yeah.
some element of the spectrum. So a lot of it is, how do we take away labels and really just look at pleasure and where does anal fit into that? It doesn't need to be full penetration. It could just be external stimulation. There's lots of different things, whether bottoming, topping, whether just side and playing in that space. So I think that that's one. I also think that a lot of people think that it should be painful, and the reality is that anal sex shouldn't be painful. Obviously, if it's part of your kink and you want there to be pain in life, that's one thing. But for most people, the whole thing of, okay, just do it. I know the first couple of times are going to be painful and blah blah blah, and I'll just bear through it. That's bullshit. And the reality is that it shouldn't be painful. It should be pleasurable. There shouldn't be blood. There's a lot of things that we will go into to kind of dispel the myths. And I think the clinician side is so important for me now in the element of where I am in my world, because I think there's not curriculums, there's not standard of care approaches. Everybody is an expert, especially online. And I think what's great about what we're doing here is kind of setting the stage of like, let's just create the framework that we're all talking the same language. And then we could start kind of building further blocks of really pushing the education out there, which I think is so cool because nobody's doing it, and the reality is that we can't wait for the government to do it. So I think the key is how do we look for organizations to really push this narrative in the right way, which is totally awesome.
So awesome. And so for heterosexual men, get out of your head and into your ass, basically, right? Because we
Yeah,
all want
or
an
but
erogenous zone there.
that's right. That's right. And so many women too have better orgasms through anal penetration. And if you are a man that, doesn't necessarily want to engage anally yourself, but you would with your partner and kind of, providing, there's so many tips. And even in the book, we talk a lot about top tips, which is like, how do you just become a better top? How do you enter the right way? How do you make sure there's communication? How do you make sure you understand the anatomy yourself so that you're able to enter correctly? Because it's not just like vaginal entry. Vaginal entry, it's self-lubricating. There's no muscle in that space. It's not that it slips right in, but it's definitely a much easier entry than the anal side. So those are the things we'll talk a lot about.
Well, thank you so much. I'm looking forward to the class, and hopefully everyone will be there.
Yeah, that sounds great. Thank you so much. Looking forward to it too.